Hi, my name is Sam Resecker, and I am a nurse and a faculty member at Brazosport College in the Health Professions Department. My role currently is to help students learn nursing skills so that they too can become a nurse. There's a couple different ways to go through school in order to get a license to be a nurse, and so I'd like to just share some of that information with you. One of the ways is to become what's called an LVN, or a licensed vocational nurse, and that typically requires 1 year of college classes at typically a community college. Another way to become a nurse is to take a 2-year program earning an associate's degree, and that's called an ADN program, or an associate degree of nursing. There's also a 4-year program where you go for 4 years, and that's called a bachelor's of nursing. And that's typically done at your universities or larger schools. So here at Brazosport College, we currently offer the LVN as well as the ADN program. And what the room that I'm standing in is one of the simulation labs that those nursing students use to practice the knowledge and skills that they're being taught by their faculty members. So I'm going to kind of give you guys a quick tour. So here you can see that our rooms are set up to resemble what a hospital setting would look like. We have a real hospital bed with a mannequin that has the capabilities of having a pulse, being able to feel their pulse in their wrist. They have heart sounds that we can listen to with our stethoscope. We can also listen to their breath sounds. When they take a breath, we can listen to the sounds that it makes inside their lungs. These mannequins also have the ability to have their blood pressure checked. Inside the room itself, it's set up very similar to the hospital setting. We do have computer electronic health record charting and results and ordering for the students to review. We have what's called the headboard at the top there that has the suction and oxygen and gloves available to the students. So on a typical day, the students would come in and be assigned to a certain bed, and they would be practicing whatever new skill they've been learning. We would then spend time going through different scenarios of, well, what if this happened? What if this happened? And what would we do in those situations? I'm now going to demonstrate one of the scenarios that our students will practice as they learn how to administer medications. Knock, knock. Hi, Mr. Jones. It's Sam. I'm the nurse taking care of you today. Are you feeling okay? You are? You're doing all right? I'm going to set my belongings here while I wash my hands. Are you having any pain or discomfort? No? Oh, that's so good. I'm glad you're feeling better. I'm going to verify your name. If you can tell me your full name, please. Alex Jones. And your birthday is 2/10/77. Okay, that matches your ID bracelet. Are you allergic to any medications that you know of? Just to betadine, and that's what I have on your bracelet as well. I'm going to move your bed up a little bit. Move this table out of the way. Did you have a good night's rest last night? Oh, good. Okay. Well, your doctor has ordered for you to have some hydration fluid that's going to go through your IV that you have in your arm. Are you having any pain or discomfort with the IV? No, very good. Well, the site looks good. There's no redness or swelling, and the dressing is dry and intact, so that looks very good. I'm going to be putting on some clean gloves. The medicine that you're going to be getting is normal saline. That's a hydration fluid. It's going to go through your IV. I'll use the IV pump to administer that medication. Do you have any questions? What's it going to do? Very good question. So it's actually going to hydrate your body. And so you may end up needing to use the restroom. If you'll press your call light and let me know. But hopefully that hydration fluid will make you feel even better. And I have normal saline, 500 milliliters, 500 milliliters. It's due now. It's not expired. Very good. It's going to go through your IV. All right, there will be a couple loud beeps as this machine turns on. This is the IV pump that helps push the medicine in at the right rate. Okay, before I hook that up to the patient, I'm going to clean the site, the IV site, with an alcohol prep pad. This removes any germs that may be sitting on the top of this piece here. I'll scrub for 30 seconds and let that dry. I'm also going to use what's called a saline flush to make sure that the site is working appropriately. Now you should not feel any pain or discomfort when this fluid goes in. And it's flushing easily. There's no swelling at the insertion site, and that didn't hurt? Very good. So that tells me that the IV is in the vein and that it's also working well. Now I can complete setting this up, connecting it to the patient. All right, Miss Jones, your medicine is going in now, that hydration fluid. I'm going to lower your bed back down. I'm going to take my gloves off and wash my hands. All right, and you have your call light here at the bedside. If you need anything at all, please don't hesitate to call me. Otherwise, I'll be back in about 30 minutes to check on you. All right, thank you. There are nurses that specialize in taking care of pregnant women and their unborn children. There are nurses that specialize in taking care of newborn babies. There's also nurses that specialize in taking care of kids, known as pediatrics. There's nurses that specialize in wound care. There's nurses that'll take care of you if you have COVID. There are nurses that'll help you if your heart stops. Hey, are you okay? I'm feeling for a pulse. There's no pulse. Call the code. One, two, three, 4, 5, 6, 7, 8, 9, 10. There's nurses that can help you if you can't breathe. I can use my stethoscope to listen to the way your heart sounds and the way you breathe, how air moves in and out of your lungs. I can help administer nutrition in a different way if you aren't able to eat. I hope you've enjoyed learning about all that nursing can entail. It's a very exciting job. It's a very hard job. I fell in love with nursing while I was in the Army Reserves. I was sick and I was watching the military nurses take care of soldiers, and I was just fascinated by all that they could do. I love that every day my job is different. There's parts that are the same, but there's never the same day over and over again. I love that I get to help people, a lot of times on the worst or scariest moments of their lives. I love that I could work anywhere in the world. I love that I could work days or nights. I love that I could choose to work with old people or young people. I love that I could choose to work from home and do nursing over the phone for different companies. There are many different opportunities in nursing that it makes it such a great and enjoyable career. Last, I just want to leave you with, if this is something you're interested in, just know that nursing school is typically very competitive to get into. And so it does require that you put in the work now to be able to do the job that you want to do later. I hope to see you guys someday soon in the future. Thank you. Bye-bye.